Hello everyone, my name is Rachel Brady and I will be doing the Financial Management in Healthcare Discussion 1. The management differences between process, financial, and clinical managers are kind of listed out here pretty simply. The process managers work with the systems of the organization, and for an organization like this, we're talking about a healthcare facility. These managers are also responsible for data accumulation, as well as filtering, processing, creating new data and information, and distributing that data. The financial managers work with finances on a daily basis, and they have to apply transformations to the stored data that they gather in their daily work, and it helps them to set priorities, focus resources mainly, and help the healthcare facility and organization as a whole adjust to changing environments because, as we know, healthcare is always changing. Clinical managers will directly deal with patients. They will help to set standards, policies, to guide providers that are under them that they manage, and hopefully go in the direction of making changes in the patient's quality of life or health for the better. So this table just shows the management differences for the process, financial, and clinical managers. It shows how they operate, what they do, what it translates to, and why it matters. This is just a simplified version of what I went over earlier, so you guys can take a quick look at this. But all of these perspectives do have to work together in order to make a healthcare system work properly and efficiently. For some managerial encounters, I do have a couple of examples. For financial, I have a friend who works as an MA in a clinic. They used to have a pediatric system, general medicine system, family doctor system, etc. No specialty doctors, just a few systems to cover the population's basic needs. They had discovered pediatrics was not generating as much income as before, so they cut the system and released the doctors, other MAs, and patients. Now with nowhere to go to take their children, some families have opted to not get or delay treatment and or their regular checkups. So that's just an example of a negative way that financial managing can affect a healthcare system. Now, a positive way from a clinical perspective would be the athletic training position statements. Managers need to provide clinical outcomes and positive clinical outcomes. That comes in the form of our position statements. And the one I looked at was for the acute management of the cervical spine injured athlete. The objective of this position statement was to provide certified athletic trainers, team physicians, emergency responders, and other healthcare professionals with recommendations on how to best manage a catastrophic cervical spine injury in an athlete. This is really important because if not done properly, then you can further injure the athlete and possibly cause life and or limb-threatening injuries and make them worse. Some management drawbacks for each of these three are listed below. I'll just go over them really quick. The process managers have limited access to daily service providers, so they're a little bit removed from the, I guess, on the ground crew, you could say. They're more data oriented versus people oriented. For financial managers, it can be more money based and oriented with those systems, like how my friend at her clinic had the pediatric system taken away because it wasn't making enough money. This healthcare system is constantly changing, so it is quite difficult for them to keep up sometimes, and maybe it's not the right decision, but financially it makes sense. Some drawbacks for clinical managers is that there is a massive collection of information and patient data that they can gather, so it just gets a little muddy sometimes. Some benefits for process managers is that they do get a big picture and they get to see the overarching goals of where the organization wants to go, and they can help push the other managers in that same direction so that everyone is on the same page. For financial managers, they deal with day-to-day expenses, which is really useful, especially in the smaller healthcare setting, because they need to more effectively use their resources because they have less of them. For clinical managers, they get to work directly with patients and see patient satisfaction and work with patients and go through problems and just be involved in their healthcare, which to me is the best part, partially because I'm also a clinician, so I'm a little biased, but to me, that'd be the best part. Just a little bit of a side note. These are tools in a manager's toolbox because no one tool can fix everything. The different perspectives represent differing ways one needs to look at an organization as a whole. We want our healthcare system to work, of course, but if managers can get their whole systems to work together efficiently by providing high quality care at a reasonable cost while maintaining positive outcomes, they have achieved the ultimate goal.